Assalamu alaikum student. Today our topic of discussion is Collagen and stye. First of all, we will derive the definition of Collagen from three words from the name of Collagen. First one is C. We take chronic from C. Middle word is L. Lipogranulomatous. The last word is N. Non-supportive and non-infective. Now, what is the definition? Chronic lipogranulomatous non-suppurative non-infective disease of eyelid is called as Chalazian. I have already explained in anatomy of eyelid. There are meibomian glands in tarsal plate. When there will be any infection in tarsal plate, then this meibomian glands, this infection blocks the meibomian glands, because the function of meibomian gland is to secrete oily secretions. Now, if there is blockage in these glands, then there will be a nodule in meibomian glands. Now, what are the symptoms of Chalazian? Our lid feels heaviness. This is painless. Lid drooping. These are the symptoms. These are the symptoms of Chalazian. Now, what we are going to do further? Basically, what are the complications if Chalazian develops? If we will not treat this Chalazian, it start too hard. After being hard, it becomes fibrous. If we will not treat this, then finally it bursts. Then there will be complications. Now I am going to tell you what is the treatment of Chalazian. First treatment is conservative, second is medical, third is surgical. What is conservative treatment? Here we provide hard compresses to this nodule, and we will also provide anti-inflammatory topical steroid drops. If it will not cover with this, we will provide anti-inflammatory IV injections. You can say triamcinolone acetonide. If it will not cover again, then final treatment is surgery. We will evert the lid and we will do surgery and remove this nodule. This is totally Chalazian. Now I will show the pictures of Chalazian. You can see here, this is our Chalazian and this is away from lid margin. This is away from lid margin. And other picture from laptop I am going to show you. This is the picture of Chalazian. You can see here, this is our Chalazian. This is also away from the lid margin. You can say this is Chalazian. Now I am going to explain what is stye, how we can compare. First of all, I will explain stye, then I will explain the comparison between stye and Chalazian. What is the definition of stye? Lid infection is called stye. There are two types of stye: internal hardulum, internum, hardulum externum. What causes the stye? The name of bacteria which causes the stye is Staphylococcus. No, internal hardulum is because of meibomian glands. The basic difference between internal hardulum and Chalazian is, in case of Chalazian, meibomian glands become completely blocked, but in case of internal hardulum, there will only be infection in the meibomian glands and there will be pus formation. Now, what is external hardulum or stye? This develops because of infection in glands of Zeiss. Here there is also will be infection in eyelashes. It has a short history. There is pus formation and this is painful to touch. When we touch this will be painful. The difference between Chalazian and stye is, Chalazian will be away from the lid margin, but stye will always be at the tip of the eyelid. What is the treatment? In this case, we will provide antibiotic eye drops, hard compresses, or remove pus from the nodule. Here I can show you the pic and comparison. We will compare the pic of stye and Chalazian. This is the pic of Chalazian. Now this is the peak of stye. Here you can say it is at the top of at lid margin. Now what is the comparison between Chalazian and internal hardulum? Here is internal hardulum and this one is Chalazian. In case of Chalazian there is a clear nodule, but there is no clear nodule, but just there is swelling. These are the pictures of Chalazian stye and internal hardulum I have explained. If you have any questions, you can ask me. Thank you so much.